Welcome to the next chapter of our journey. Understanding endometriosis. This condition affects millions of women, yet it often goes undiagnosed. Today, we'll explore its causes, symptoms, and management strategies, empowering you with knowledge for better health. Endometriosis is more than just a painful period. It's a chronic inflammatory condition where tissue similar to the uterine lining grows outside the uterus. This can cause severe pain, fertility issues, and other complications, making early diagnosis and treatment essential. Endometriosis occurs when endometrial-like tissue grows in areas where it shouldn't, such as the ovaries, fallopian tubes, and pelvic organs. This misplaced tissue behaves like normal uterine lining, thickening, breaking down, and bleeding with each cycle. But with nowhere to go, it causes inflammation and pain. Where does endometriosis occur? Endometriosis can affect multiple areas of the body. The most common sites include the ovaries, where it forms cysts called endometriomas, the fallopian tubes, potentially causing blockages, and even the bowel and bladder, leading to digestive and urinary symptoms. Types of endometriosis. There are three main types of endometriosis: superficial peritoneal endometriosis, where tissue grows on the abdominal lining; ovarian endometriomas, which are cysts on the ovaries; and deep endometriosis, where tissue penetrates deeper into organs, causing severe pain and complications. What causes endometriosis? The exact cause of endometriosis is unknown, but several theories exist. Retrograde menstruation suggests that menstrual blood flows backward into the pelvic cavity. Other factors include genetic predisposition, immune system dysfunction, and hormonal imbalances. Risk factors for endometriosis. Certain factors increase the risk of developing endometriosis. These include a family history of the condition, early onset of menstruation, short menstrual cycles, and never having given birth. Identifying these risks can help with early diagnosis. Common symptoms of endometriosis. Endometriosis symptoms vary, but the most common include severe pelvic pain, painful periods, pain during intercourse, and heavy bleeding. Other signs may include digestive issues, chronic fatigue, and infertility. Beyond pain and menstrual irregularities, endometriosis can cause excessive bleeding, gastrointestinal problems like bloating and nausea, and even emotional distress due to chronic discomfort and fertility struggles. How is endometriosis diagnosed? Diagnosing endometriosis can be challenging. Doctors rely on medical history, pelvic exams, ultrasounds, and sometimes laparoscopy, a minimally invasive surgery that allows direct visualization of endometrial tissue. Stages of endometriosis. Endometriosis is classified into 4 stages based on severity. Minimal, stage 1, with few superficial implants. Mild, stage 2, with more but shallow implants. Moderate, stage 3, with deeper implants and small cysts. And severe, stage 4, with extensive tissue growth and large ovarian cysts. Treatment options for endometriosis. Endometriosis treatment focuses on symptom relief. Options include pain management with NSAIDs, hormonal therapy to slow tissue growth, and in severe cases, surgical intervention to remove lesions. Hormonal treatments for endometriosis. Hormonal therapies help control endometriosis by suppressing estrogen. Birth control pills regulate cycles. Progestins reduce tissue growth, and GnRH agonists create a temporary menopausal state to relieve symptoms. Surgical approaches for endometriosis. For severe endometriosis, surgery may be needed. Laparoscopy is the gold standard, removing or burning endometrial lesions while preserving fertility. In extreme cases, a hysterectomy may be considered if other treatments fail. Endometriosis and fertility. Endometriosis is a leading cause of infertility, affecting up to 50% of cases. It can distort pelvic anatomy, cause inflammation, and impair egg quality. However, fertility treatments, including surgery and assisted reproductive technologies, offer hope. Endometriosis. Diet. Foods that may help. A balanced diet can help manage endometriosis symptoms. Fruits and vegetables reduce inflammation. Omega-3 fatty acids support hormone balance, and whole grains promote gut health. These dietary changes can ease pain and improve overall well-being. Foods to avoid with endometriosis. Certain foods can worsen endometriosis symptoms. Processed foods, red meat, trans fats, caffeine, and alcohol may increase inflammation and estrogen dominance. Avoiding these can help reduce flare-ups and discomfort. Lifestyle changes for managing endometriosis. Managing endometriosis goes beyond medication. Regular exercise, stress reduction, adequate sleep, and heat therapy for pain relief can make a big difference in overall well-being. Alternative therapies. For endometriosis, holistic approaches can complement medical treatments. Acupuncture, herbal medicine, pelvic floor therapy, and mindfulness techniques may help alleviate symptoms and improve quality of life. Endometriosis in adolescence. Endometriosis can start as early as puberty. However, it's often misdiagnosed as normal period pain. Early recognition and intervention can prevent severe complications later in life. Endometriosis and pregnancy. Pregnancy may provide temporary symptom relief due to hormonal changes, but symptoms often return after delivery. Women with endometriosis require careful monitoring during pregnancy. Long-term management of endometriosis. Since endometriosis is a chronic condition, long-term care is essential. Regular follow-ups, hormonal maintenance therapy, and pain management strategies ensure better quality of life. Endometriosis. Support and resources. Support groups, educational materials, and advocacy networks help women navigate endometriosis. Connecting with others who share similar experiences can provide emotional and practical support. Comparing PCOS and endometriosis. While PCOS and endometriosis both affect reproductive health, they have distinct causes and symptoms. PCOS involves hormone imbalances and ovulation issues, while endometriosis is an inflammatory disorder with severe pain and tissue growth outside the uterus. Can you have both PCOS and endometriosis? Yes, though rare, some women experience both PCOS and endometriosis. Since both conditions affect hormones and reproductive health, managing them together requires a personalized approach combining hormone therapy, lifestyle changes, and medical treatment. Since PCOS and endometriosis have overlapping symptoms like irregular periods and fertility issues, diagnosis can be tricky. A combination of hormone tests, ultrasounds, and sometimes laparoscopy helps doctors differentiate between the two and create an effective treatment plan. Impact on quality of life. PCOS versus endometriosis. Both PCOS and endometriosis can significantly impact a woman's physical and emotional health. PCOS often causes weight gain, insulin resistance, and metabolic issues, while endometriosis leads to chronic pain and inflammation. Understanding these differences helps in better symptom management. Future directions in PCOS and endometriosis. Research. Exciting research is underway to find better treatments for both conditions. Scientists are exploring genetic links, new hormone therapies, and potential non-hormonal treatments that could offer long-term relief without side effects. Importance of early diagnosis. Early detection of PCOS and endometriosis can prevent long-term complications like infertility, metabolic disorders, and severe pain. Tracking symptoms, seeking medical advice, and getting regular checkups are key to better health outcomes. Empowering patients. Self-advocacy in women's health. Women's health deserves attention and care. Being informed about your condition, tracking symptoms, asking questions, and seeking specialist care empower you to make the best decisions for your well-being. The role of mental health support. Living with chronic conditions like PCOS and endometriosis can be emotionally challenging. Seeking therapy, joining support groups, and practicing self-care can help manage stress, anxiety, and depression related to these conditions. Nutrition and lifestyle. A holistic approach. A balanced diet, regular exercise, and stress management play a major role in controlling both PCOS and endometriosis symptoms. Reducing processed foods, prioritizing sleep, and practicing mindfulness contribute to long-term health improvements. Fertility preservation. Options. For women concerned about fertility, options like egg freezing, lifestyle changes, and hormone therapy can improve future pregnancy chances. Consulting a fertility specialist early ensures better planning and reproductive health support. Emerging treatments and research. Advancements in PCOS and endometriosis research are paving the way for better treatments. Studies on inositols, immune-modulating therapies, and gut microbiome influences offer new hope for managing these conditions effectively. Managing chronic conditions. Long-term strategies. Since PCOS and endometriosis are lifelong conditions, long-term strategies like routine checkups, symptom monitoring, and adapting treatment plans are crucial. A proactive approach leads to better symptom control and quality of life. The importance of a multidisciplinary approach. Managing these conditions often requires a team of experts: gynecologists, endocrinologists, nutritionists, pain specialists, and mental health professionals. A comprehensive approach ensures well-rounded care and better outcomes. Patient testimonials. Living with PCOS and endometriosis. Many women face struggles with PCOS and endometriosis, but with the right treatment and lifestyle changes, they find relief and hope. Real stories from those managing these conditions highlight the importance of awareness, early intervention, and self-care. Empowering women's health. Understanding endometriosis is the first step toward better management. With the right medical support, lifestyle changes, and awareness, women can take control of their health and improve their quality of life. Thank you for taking the time to learn about endometriosis. Raising awareness helps women seek early diagnosis and proper care. Stay informed, stay strong, and always prioritize your well-being.